Welcome to Maryland Medicine Frontline News. This week in our new Discovery segment, we'll learn about the lifelong impact of having high cholesterol. But first, the Center for Vaccine Development is poised to start a new Phase 3 clinical trial.
The information that we have so far from the Novavax vaccine is very, very promising.
The vaccine candidate was developed by Novavax, a Maryland-based company, and will be given to 400 participants in the coming weeks.
It looks like a very well-tolerated vaccine, and despite that, the immune responses that have been seen so far in people are outstanding. So we're very enthusiastic about this vaccine.
Part of the nation's Warp Speed initiative, it's the CVD's third Phase 3 trial aimed at COVID-19. The Moderna and Pfizer vaccines both use messenger RNA to trigger an immune response. The Novavax vaccine works differently.
The Novavax vaccine and another vaccine made by Sanofi are made just of the spike protein, and the spike protein is that little protein that we see coming off of the virus, little spikes, and the virus uses that to attach to our cells and enter our cells and cause infection. So if we have antibodies to that protein and the virus, the real virus infects us, and we have antibodies, they attach and they don't let the virus get into our cells.
Other vaccines are being tested elsewhere, and Dr. Kotloff believes one or more will be available in mid-2021.
None of these vaccine platforms can give you coronavirus infection. None of them can cause COVID. They're just intended to boost your immune response to the coronavirus, so if you ever see the real infection, you can be protected.
I certainly want to recognize some of our leaders who have been very much involved in this effort. Obviously, Dr. Kathy Nuzzel, who is the co-lead of the National Warp Speed effort across the United States, but also Dr. Karen Kotloff and Dr. Kristen Leich, all of whom are members of the Center for Vaccine Development, but all of whom are actually very, very much involved in these vaccine trials. I'm very optimistic that these trials are going to have an impact not only on a local level, but also nationally and internationally. So I just couldn't be more proud of the effort that we're undertaking at the present time.
This week we launch our new Discovery segment, featuring research advances by the School of Medicine faculty. We've known for a long time that having high cholesterol can lead to serious health problems. But now Dr. Michael Domanski has shown that having high cholesterol, even in your teens or early 20s, can increase your risk of having a heart attack or stroke during middle age.
For younger people, for instance between 18 and 30, the risk they acquire early is actually greater per unit area than the risk that you acquire later. So those trips to fried food places early in life actually result in risk later that you just don't get rid of.
Dr. Domanski says artery damage early in life may be irreversible and appears to be cumulative. And the risk remains even when LDL cholesterol levels are lowered later in life.
The implications of that are that if we're going to try to prevent coronary heart disease, the way to do it is we're going to have to start early in life, not wait till we're 30 or 40 to start, because some of the risk anyway that we've built up as young people doesn't go away.
The landmark study was published in the Journal of the American College of Cardiology. With co-author Dr. Charles Hong and data science experts at the University of Maryland, the team analyzed NIH data going back 35 years. Dr. Domanski hopes the study will lead to action.
If one looks at the toll of coronary heart disease and stroke, which is due to blockages in blood vessels, it will kill more people in the lifetime of a child alive today than all the wars of history combined. If we're going to make any dent in that epidemic, and it's a worldwide epidemic, it's not just the developed nations, it's the developing nations as well, we need to prevent the disease. We're not going to stent our way out of that pandemic, really, of coronary heart disease. And we now know, based on this paper, that if you're going to really make a dent, you need to start very early. You can't wait till people in their middle years.
Dr. Domanski says treating young people for high cholesterol with medication should be considered. That's Maryland Medicine Frontline News. I'm Larry Roberts. I hope you will join us again next week.